French lawmakers voted 291 to 241 to approve legislation creating a legal right to assisted dying for adults suffering from serious and incurable illnesses. Under the bill, eligible patients may receive a lethal substance for self-administration or, if physically unable, with assistance from a doctor or nurse. The French government says the legislation includes strict legal safeguards.
It is a wish safeguarded by the most rigorous guarantees. The patient must be of legal age, suffer from a serious and incurable condition that is life-threatening in its advanced or terminal stage, and experience suffering that is refractory or unbearable, in addition to being a French national or a stable lawful resident of France.
Supporters say the legislation gives terminally ill patients greater autonomy while preserving protections for healthcare professionals. They argue the law is intended for people facing unbearable suffering with no prospect of recovery, and that it provides an additional end-of-life option rather than replacing palliative care.
We are speaking of women and men condemned by illness. We are speaking of patients whose suffering has become unbearable. We are speaking of people who know they are going to die. This text represents a right. It represents a choice, a right for the patient, a choice for the healthcare professional. It represents a freedom. It allows us to put an end to injustices.
Permet de mettre fin à des injustices.
The vote followed months of passionate debate across France, with opponents warning that legalizing assisted dying could undermine protections for vulnerable patients. Demonstrators gathered outside Parliament urging lawmakers to strengthen palliative care instead of introducing medically assisted death. Opponents say improving end-of-life care should remain the priority.
I hold all those who are suffering in my prayers, or at least in my heart. And I believe that death will never be the solution. It is the wrong solution. While it may be the quickest and the quietest, it will never be the right one. We really need to expand palliative care. In fact, I consider this to be immoral and frankly unhealthy. As beings created for life, can we really inflict death?
Comme nous en avons connu peu dans notre histoire.
Opinion surveys indicate broad public support for assisted dying in France, but the issue remains deeply divisive. As the legislation moves through the remaining stages of the legislative process, the debate over ethics, dignity, and end-of-life care is expected to continue.